Welcome back. I'm An Yang. Attention Deficit Hyperactivity Disorder, or ADHD, affects approximately 8% of kids, and many parents struggle with the decision to medicate their child or not. Fortunately, parents have other options. Psychiatrist Dr. Joshua Weiner joins us now to talk about which ones help the most. Now, the decision to consider daily medications for kids with ADHD can be a really scary one for parents. Now, is that fear warranted?
Well, I think it is a hard decision for a lot of people because you have to remember, these are medications that if you go that direction, you're talking about months or years in which your child might need these medications. So it's definitely not a decision to be made lightly. However, I do think some of the fear surrounding these medications is overblown. Most kids do very well with these medications. By far, the biggest problem that people will have is decreased appetite and concerns about weight gain. And then sometimes there are some other things like blunting of personality or a mood or energy crash or what we call rebound hyperactivity when the medicine wears off. But these things occur in maybe 10–15% of people. The appetite thing's really the big deal. So I do think it's warranted to some degree, but a little overblown.
Now, some parents may look to alternate ways to treat ADHD. Can you talk about some of the ones that work the best?
So the one that has the most data are the omega-3 fatty acids. So these are essential amino acids. They're the only things that have been shown in what we call double-blind, placebo-controlled studies to work. And so what we're talking about here are things that you have to get in your diet, or you could take a supplement. Most people have heard of DHA, and then there's another one called EPA. So DHA is an omega-3 involved in early brain development. EPA is the one that you really want to pay attention to when you're talking about treating ADHD. So what people want to do is they want to look for a product that has roughly 1.5 to 2 times as much EPA as DHA. You want to take roughly 800 milligrams per day of EPA. And that has been shown, again, to offer some benefits. It's not going to work as well as medication, but it is definitely worth trying.
And what are some other supplements or vitamins and minerals that a child could take that would work, maybe not as well as omega-3, but in addition to, and would that be beneficial as well?
Right. So there are a few others. Magnesium, there aren't studies showing clear benefits for ADHD, but it can help with some of that rebound hyperactivity that some kids get when they take these ADHD medications. Magnesium just has a calming effect. So you're looking at taking roughly 250 milligrams of magnesium citrate. A couple other things are zinc. Zinc has been tied to ADHD a little bit. Taking 20 milligrams a day of zinc can offer some benefits. The final thing is iron levels. Studies have shown that kids with ADHD tend to have lower iron levels. So what you're going to want to do is maybe talk to your pediatrician or your doctor about checking something called ferritin levels, which are iron store levels. If they're under 30, you might consider taking an iron supplement.
And how soon before a parent would see the results of this sort of the supplements versus medication?
So in general, you need to take these supplements for about 3 months. So I would tell people, take them for 3 months. If you see benefits, great, keep them going, because generally these are all pretty well tolerated and fine for you. If you don't see anything after 3 months, well, at that point you could just stop.
All right. And there are no side effects of taking them together, like a magnesium with an omega-3, that sort of thing?
No, that's all safe. Generally, what I do advise, though, is people to start with one. I would start with the omega-3s, try that, and then add others if you need to. If you start too many things at once, you just don't know what's doing what.
All right, some great alternatives there. Dr. Joshua Weiner, thanks as always.
My pleasure.
It.